Welcome to Getting Understanding with Dr. Daryl Ellis. We want to touch on a few things today that we hadn't spoken about before. I want to talk to you about the top 3 things, the top 3 words of advice that I would give a 20-year-old today. Number 1, don't smoke. If you've already started smoking, quit now before it gets so deep and so difficult for you to get off and you've developed some of the long-term complications of tobacco use. Smoking does more than just cause problems with your lungs. It also increases your risk for virtually every type of cancer that we know of. It also causes problems with respect to elevated blood pressure, peripheral vascular disease, increased risk of heart attacks, strokes, kidney failure. It's a bad player. There are more than 110 different cancer-causing agents in each puff of cigarette smoke that you take. Think about it. The second thing that I'd like to advise a 20-year-old is watch your diet. You're going to want to have a well-balanced diet. The earlier in life that you develop a well-balanced diet, the easier it's going to be for you to keep that well-balanced and maintain a good height-weight balance. You know, when we're young, our metabolism is really fast and we think we can just eat whatever we want to eat and not gain weight. And for a while, that's true. But for each individual, the time when your metabolism starts to slow down is a little bit different. And if you don't have the proper eating habits, the next thing you know, you turn around and after a couple of years, you've gained 10, 15, 20 pounds. They used to call it the freshman 15 because usually when people go to college at around age 18, they start gaining a lot of weight. Their activity level has decreased, their metabolism starts to slow down, and all of a sudden, 15 or 20 pounds comes out of nowhere, and now you're trying to figure out how to get rid of it. So get a good healthy diet early. Practice healthy eating habits often and consistently, and this won't be a problem for you. The third bit of advice that I would give a 20-year-old has to do with sex. It's God's will that we save sex until marriage. However, that's His perfect will. He also has His permissive will. He gives us the opportunity to make a choice each day about which way we go. If you've chosen to participate in sexual activity prior to marriage, do it safely. Try and protect yourself as well as any sexual partners that you have. One of the things that we are instructed to do as physicians, particularly in family medicine, is starting from the age of 16 to the age of 26, once a year we're supposed to do a sexually transmitted infection screen because the risk of sexually transmitted infections is so high in that age group that part of the screening process needs to be implemented as part of a routine physical examination. Don't be one of the people who ends up having to have a problem with an STI because all sexually transmitted infections are not curable. I hope you like the content on today's program. If so, please hit that like button. The more likes we get, the better we progress in the algorithm here on YouTube. It'll help us a lot. Also, don't forget to hit that bell notification button so that as we continue to roll out new content, you'll be one of the first to be notified. And then lastly, subscribe to the channel. The more subscriptions we get, the more we know that the content that we're putting out there is really starting to affect and impact people. Our goal is to educate. Our goal is to enlighten. Our goal is to be able to answer questions for you in a forum that doesn't cost you anything. If you go to the doctor with these questions, you're going to have to pay a copay. So ask them here. We'll be glad to answer them for you. God bless you.